In this video, I'm going to talk about low energy or fatigue and what you can do about it. Now, one of the most common reasons patients see me is because of low energy, and in general, that's one of the most common complaints that they have when they go see their physician. And clearly, the fast paced lifestyles that we live nowadays contribute to low energy, but there can certainly be more deeper causes. And in this video, we're going to look at those deeper causes. So, number one, when a patient comes and sees me and their complaint is low energy, amongst other complaints, the first thing that we have to do is get a very detailed history because it's very important for me to know exactly the circumstances of their fatigue, when their fatigue happens. Is it continuous? Has it been going on for several months or years now and it becomes more chronic? Um, and this requires me to have a detailed discussion with them, understanding their unique health history, their lifestyle, and several other factors. The second thing that we have to do is we usually have to do detailed blood analysis. And blood work is very important when it comes to energy. And I think what happens a lot of the times, at least my experience with my patients, is that when they have a complaint like this and take that to their physician, they get a very basic blood panel done. That could be a complete blood count, a metabolic panel, a lipid panel, and an A1C, sometimes a TSH for thyroid checking. But that often isn't enough of a detailed approach to look at low energy or fatigue. And so we want to discuss what are those factors in the blood that we need to look at to ensure that the common causes of low energy can be addressed. So number one is iron. So a full iron panel with ferritin needs to be done because low iron is often a cause of low energy. And so that should be looked at because that is usually an easy fix. Either oral iron or sometimes IV iron is needed if oral iron doesn't work well enough. So iron is important to check. Number two, as I mentioned, the CBC or complete blood count. This is basically looking at your white blood cells, your hemoglobin, and your platelets. And amongst these, your hemoglobin is the most important one as it pertains to energy, because if you're anemic, you can have low energy amongst other symptoms. The third thing to look at is your thyroid levels. Thyroid hormone is one of those hormones that is responsible for various metabolic functions around the body. And low or suboptimal thyroid levels, and I say suboptimal because it's not just about having levels below the range. If the levels are towards the lower side of the range, you definitely have to look at that as a potential cause for low energy and some of the other symptoms you're having. So, iron, complete blood count, thyroid levels. Then comes vitamin D. Vitamin D is also very important, not just a vitamin, but more like a hormone in the way that it acts, and is also very important for energy, for mood, and overall mental health. It's important for immune function and various other mechanisms and various other needs. And so after vitamin D comes B12, vitamin B12. That's another one that if it's low, it's going to result in low energy. So we discussed some of these common ones. We shouldn't forget things like testosterone and sex hormones. This is also very important for energy as it pertains to both men and women. It's very important that even in women, we are looking at these levels, even though it is not really present in the convention or mainstream to think that low testosterone can affect women, or it's a big deal in women, or that they can benefit from testosterone replacement. So certainly when we're talking about a holistic approach, we want to look at all of these things. So in the blood work, definitely a full iron panel with ferritin, thyroid levels, vitamin D levels, vitamin B12 levels, testosterone and other sex hormones like estrogen, progesterone is important. As you get older in age, those hormones are going to play a big role in overall how you're feeling. So these are some of the more common blood tests that need to be done as part of a full panel. Then there are some other components to energy that shouldn't be overlooked. So a lot of times when you're doing just these blood panels and you see that there isn't really something that's off that you can tangibly see in the blood, then you often get prescribed a medication. It could be a SSRI, it could be some other medication you get prescribed without looking into some of the deeper causes of what can be causing your low energy. So to that, we should be looking at gut health. Gut health is very important because what you eat can certainly have an impact on your immune system, inflammation, and overall how you feel. And that can contribute to low energy. So, a poor diet or inflammation and gut issues in general, that could range from anywhere from bacterial imbalances such as SIBO, which is small intestinal bacterial overgrowth, to an entity called leaky gut or intestinal permeability. Um, these are sometimes considered buzzwords, and I know there's sometimes controversy around these issues in the wider medical world, but it's still very important to look at, and it's definitely something that needs to be addressed. These are real issues that impact real patients, and I can say firsthand that patients have seen a benefit when a lot of these issues get treated. So gut health as a general is important. Gut health can involve doing an elimination diet at times, which oftentimes removes a lot of inflammatory foods that can be causing symptoms of low energy and other symptoms. So, gut health is very important to look at. The other thing to look at is sleep apnea. That's not one to forget either, because poor sleep in general and a clear diagnosis of sleep apnea is also a big hidden contributor to low energy. So, getting a home sleep study if it's needed, or getting an in lab sleep study is also very important. So, these are some very important issues as far as low energy goes. In summary, I would say that if you have low energy, what you want to do is make sure that you're seeing your physician, getting a detailed history so you can know exactly what are the factors pertaining to your story. What are your lifestyle factors, right? What things can be changed? Because sometimes you just need that other person to look at things objectively. Maybe you're not getting enough sleep. Maybe you have an incredibly stressful lifestyle. Maybe you're a nurse working a night shift, and that's contributing to significant fatigue. But something for a professional to look at with a detailed history, followed secondly by blood work, which includes not just your basics, but includes a detailed iron panel with ferritin. It includes a CBC, which is a complete blood count looking at anemia. It includes a vitamin D level. It includes a vitamin B12 level. It includes testosterone and other sex hormones. All of those as part of a detailed blood panel to try and look at what is the underlying cause of your low energy, followed by gut health that is always plays a potential role in low energy. So looking at what are you eating, what imbalances might be going on in your gut, that's very important. And then beyond that, there are other things such as um, sleep apnea that I mentioned. Now, there's another world outside of this where chronic fatigue and there are certain poorly understood entities out there like mold toxicity and other environmental toxicities. And when I say poorly understood, I'm talking about in the medical world in general. I think there is definitely a place for in the literature and in general medicine for these issues, but unfortunately, our mainstream conventional medicine has lagged behind in understanding some of these issues. And so now, in the current time that we're in, a lot of patients don't have the adequate resources um, to improve and heal from these issues, some of these chronic issues like mold and so on. Um, and that's a separate conversation. But I do want to mention that there are various levels that you want to try and hit, starting with the blood work and then going deeper and deeper and progressing thereafter. So the key takeaway is you try to find what is the imbalance, what is going on in your situation, both from a lifestyle perspective, dietary perspective, and in your blood work. And then you try and make a plan that addresses all of those things systematically so that your energy levels can improve. So, this was a little summary of how I look at low energy. And if you do struggle with low energy or you do have any comments or questions, please leave them below. And thank you very much for listening.